Hello, everyone. Welcome today to our webinar on what you need to know about COVID-19 and the role of the community health workers in the Latino community. This webinar is a collaboration between NACHW and CDC. My name is Colleen Barbero. I'm a health scientist on the Applied Research and Translation team in CDC's Division for Heart Disease and Stroke Prevention. And I'm here today with Denise Smith, and I will let her introduce herself.
Good afternoon, everyone. Thank you so much, Colleen and the whole team at the Centers for Disease Control. My name is Denise Octavia Smith, and I'm the Executive Director of the National Association of Community Health Workers. Great to be joining you.
Great, so just a few housekeeping items before we get started. I first wanted to mention that the slides and recording from this webinar will be posted afterwards, so you will have access to these things later. We'll also be taking questions at the end through the Q&A button at the bottom of your screen. And you do have access to the Q&A box during the webinar, so feel free to type in questions for myself and or Denise at any point, and we'll do our best to answer your questions after the presentation. Next slide. So today's objectives for the presentation will first provide an overview of COVID-19 that community health workers can apply when guiding COVID-19 prevention in the communities that they serve. We'll discuss the evidence-based COVID-19 prevention recommendations on how individuals can help themselves, their families, and communities in preventing or slowing the spread of COVID-19. We'll share messages, tools, and other resources in Spanish that health promoters may use to inform at-risk groups, including older adults and people with underlying conditions. And we'll discuss the experiences of community health workers and the changing roles that they face in the COVID-19 pandemic. Next slide. Let's start with a coronavirus background. So the coronavirus refers to a large family of viruses that cause respiratory illness. It was first isolated in the 1960s. It's named for the crown-like spikes on the surface. There are 4 subgroupings, alpha, beta, gamma, and delta. And some of the coronaviruses can spread between animals and humans, or what is known as zoonotic disease. Next slide. Right, next slide. There are 7 human coronaviruses listed on this slide. The common human coronaviruses are provided at the top, and then other human coronaviruses include SARS and MERS. Next slide. So the common human coronaviruses, let's talk now about the clinical presentation and diagnosis. They usually cause mild to moderate upper respiratory tract illnesses like the common cold. They may cause more severe disease like pneumonia or bronchitis. They're more common in infants, older adults, and people with underlying conditions that weaken the immune system. The symptoms of coronaviruses may include runny nose, headache, cough, sore throat, fever, and general unwell feeling. Diagnosis involves lab tests that can be used to test respiratory specimens and serum or blood for coronavirus infection in patients with more severe disease. Next slide. So common human coronaviruses, let's talk now about how they spread. They're most commonly spread from an infected person to others through respiratory droplets by coughing, sneezing, or talking, close personal contact, such as touching or shaking hands, and touching an object or surface that has the virus on it. These viruses commonly occur in fall and winter, but they can occur year-round. Young children are most likely to get infected with the common human coronaviruses, and most people will get infected at least once in their lifetime. Next slide. So let's talk briefly now about some other human coronaviruses that you may have heard of called SARS and MERS. Next slide. SARS and MERS were recognized in the early and mid 2000s, or I'm sorry, after 2010, the SARS virus was first recognized in 2002 in China. The MERS virus was recognized in 2012 in Saudi Arabia. And the scope of the outbreaks included SARS having 8,000 plus probable cases and 774 deaths from 2002 to 2003. There's been no known human cases of SARS since 2004. For MERS, there were 2,400 plus lab confirmed cases and 850 plus deaths as of October 3rd, 2019. And 2 US cases in 2014 were among healthcare professionals. Next slide. Looking at the clinical picture for SARS and MERS, it involves, these viruses involve transmission between people through close person-to-person contact. The most common symptoms include fever and chills, body aches, cough, shortness of breath. Complications can include pneumonia in SARS and MERS particularly, as well as kidney failure in MERS. As far as treatment, there's no specific antiviral treatment licensed for SARS or MERS, and individuals seek medical care to relieve their symptoms. Looking at prevention, no vaccine is available, and everyday preventive actions to prevent the spread of respiratory viruses, including hand hygiene, are important. Next slide. Let's move on now to discuss coronavirus disease 2019, or what is known as COVID-19. Next slide. COVID-19 was first identified in Wuhan, China in December of 2019. It's caused by the virus SARS-CoV-2. Early on, many patients were reported to have a link to a large seafood and live animal market. Later, patients did not have exposure to animal markets, and this indicated person-to-person spread. Travel-related exportation of cases has been reported. The first US case was reported on January 21st, 2020, and CDC is reporting confirmed COVID-19 cases in the US online at our website, and the link is provided here. Feel free to keep updated on the cases here using that link. Next slide. COVID-19, we know a little bit about how it spreads based on what is known from other coronaviruses, but investigations are ongoing to better understand the spread of this particular virus. It is presumed to occur primarily through close person-to-person contact through respiratory droplets produced when the infected person coughs, sneezes, or talks. And it is possibly spread by touching a surface or object that has the virus on it and then touching the mouth, nose, or eyes. Next slide. So symptoms of COVID-19, the main symptoms include fever, cough, and shortness of breath. There have been a wide range of illness severity that has been reported. Some have mild to severe illness, and it can result in death. Estimated incubation period is 2 to 14 days, and complications may include pneumonia, respiratory failure, and multi-system organ failure. Next slide. We'll talk now about how you can prevent COVID-19. There are some everyday actions that you can take to prevent respiratory illnesses. You want to avoid exposure to the virus. You can wear cloth face covering if you're leaving the house. You don't want to touch your eyes, nose, or mouth. You want to cover your mouth when you're coughing or sneezing with a tissue and then discard it after use. You'll also want to avoid contact with people who are sick, and you'll want to stay home if you are sick, recognizing the fact it will be easier for some to stay home than others, makes practicing these everyday actions at work all the more important. Next slide. So everyday actions to prevent respiratory illnesses include coughing or covering your cough or sneeze with a tissue and throwing it away. As I mentioned, washing your hands often with soap or water for at least 20 seconds is also important, and you want to use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not readily available. You also want to clean and disinfect frequently touched objects and surfaces. And we do acknowledge that many poor families are without soap and sanitizer at this time, and some individuals are homeless. And we see a role for community health workers in coordinating with community-based organizations, including the police department, fire departments, to help access these essential products. Next slide. So let's talk a minute now about washing your hands the right way. First, you'll want to wet your hands with clean tap water and close the key in soap. Then you should rub your hands together with the soap to create a foam. You want to be sure to wash the backs of your hands, between your fingers, and under your fingernails. And the whole process should last 20 seconds. If you don't have a watch handy, you can keep rubbing your hands until you're done as you're washing them, and sing the happy birthday song twice. You can rinse your hands thoroughly with clean tap water and dry your hands with a clean towel, electric hand dryer, or air dryer. Soap and friction are what help to lift the dirt, grease, and microbes, and that's why it's so important to wash your hands by following these steps: wet, lather, scrub, rinse, and dry, so you can stay healthy and keep those around you healthy. Next slide. Cleaning and disinfecting, as I've said, is very important. You'll want to wear disposable gloves to clean and disinfect. You'll want to routinely clean and disinfect high-touch surfaces, and high-touch surfaces include tables, doorknobs, light switches, countertops, handles, desk, phones, keyboards, toilets, faucets, sinks, etc. You'll want to clean the visible dirty surfaces using soap and water. And when you're disinfecting, you'll want to use EPA-registered household disinfectants. And we've provided a link here on this slide to those disinfectants. You can visit that website and find a list. You will want to make sure you follow the instructions on the label to ensure safe and effective use of the product. So just a moment here, we'll discuss using household bleach to disinfect surfaces. To do this, you mix 5 tablespoons or 1/3 cup of bleach per gallon of water. Or you can mix 4 teaspoons of bleach per quart of water. Let me say that again because I tripped over my words and I want to get it correct. 4 teaspoons of bleach per quart of water. You'll want to follow the manufacturer's instructions for proper application and ventilation. And you'll want to check to make sure the product hasn't passed its expiration date. You never want to mix household bleach with ammonia or any other cleaner. Unexpired domestic bleach will be effective against coronaviruses when properly diluted. Next slide. So we can talk a minute now about social distancing. This is keeping space between yourself and other people outside of your home, and this is essential to preventing the spread of the coronavirus. To practice social distancing, you'll want to stay at least 6 feet or 2 meters away from other people when outside of the home. You do not want to gather in groups. You want to avoid crowded places and mass gatherings, and do not hug, kiss, or shake hands. Another thing is to avoid close contact with people who have symptoms. And this public health measure is just very important and something you've probably been hearing a lot about. And we do know that social distancing is a challenge for many families who are sharing one space. It's even more crucial that these households follow safety guidance when trying to prevent the spread of coronavirus, and that includes hand washing, cleaning surfaces, etc. There is a web page on the CDC coronavirus or COVID-19 website that discusses guidance for those living in close quarters. Next slide. CDC recommends wearing cloth face coverings outside of the home to help prevent the spread of COVID-19. I'm sure you've been hearing about the use of cloth face coverings. You do not place the cloth face coverings on children under the age of 2 or anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. A washing machine can be used to wash a face covering routinely, and you'll want to continue to take other preventive actions even when you're wearing a cloth face covering. You'll want to remain at least 6 feet apart from other individuals. You'll want to wash your hands often. You'll want to clean high-touch surfaces in your home often, and you do still want to stay home when you're sick. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders. Next slide. We know now that some are potentially at a higher risk for COVID-19, and these individuals include those 65 years or older, people who are living in a nursing home or long-term care facility, people of all ages with underlying medical conditions, particularly if they're not well controlled, and this includes people with chronic lung disease or moderate to severe asthma, and people with serious heart conditions. Next slide. Another group that are highly at risk are those who are immunocompromised. Cancer treatment, smoking, bone marrow or organ transplantation, immune deficiencies, and poorly controlled HIV or AIDS put individuals at risk. Prolonged use of corticosteroids and other immune weakening medications are also putting some individuals at a higher risk. People with severe obesity, which is defined as a body mass index or BMI of 40 or higher, as well as people with diabetes, people with chronic kidney disease undergoing dialysis, and people with liver disease are also all at risk. At this present time, we have no specific information about the risk of COVID-19 in people with HIV. The risk from immune suppression is not known, but with other viral respiratory infections, the risk for people with HIV getting very sick is greatest in people with a low CD4 cell count and people not on HIV treatment, antiretroviral therapy or ART. People with HIV can also be at an increased risk of getting very sick with COVID-19 based on their age and other medical conditions. Next slide. We are now talking about COVID-19 treatment. There's no specific antiviral treatment license for COVID-19. There is supportive care to relieve symptoms and manage pneumonia and respiratory failure. Next slide. You do want to seek medical care if you feel sick with a fever, cough, or difficulty breathing, and if you have been in close contact with a person known to have COVID-19, or if you live in or have recently been in an area with ongoing spread of COVID-19. There are additional symptoms that indicate it's a medical emergency and immediate care is needed. This includes trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. And there's more about that on the CDC website, so please visit it. Next slide. So lastly, there's a few links on this slide. You do want to stay informed about COVID-19 and the most recent information. All the information I've been discussing is found online at www.cdc.gov/COVID-19. There's also the CDC travel advisories that you'll want to check and find areas with ongoing spread and with level 2 or 3 travel health notices. And there's also pages on stress and coping that you might find helpful. All right, so I'd like to turn the presentation over now to Denise to talk about the role of community health workers and COVID-19.
Well, good afternoon again, everyone. My name is Denise Octavia Smith, and I'm the founding executive director of the National Association of Community Health Workers. I just want to thank Colleen and Betsy and the team at the Centers for Disease Control for taking time to develop this presentation specifically for community health workers. Next slide, please. Who is a community health worker? If you are looking at the slides now, I'm referring to the definition by the American Public Health Association. I know there are some that are connecting to us only by phone. We've put here this definition of CHWs as trusted members who have an unusually close or unique understanding of the community that they're serving. Those who are serving as a liaison between health and social services in the community, those who facilitate access to a variety of services from health systems, behavioral health, and community-based services, those who improve the quality and cultural competence of service delivery, those who increase individual and community capacity by increasing health awareness. And I'm going to use the term today, community health worker, as an umbrella term. This includes our promotores de salud, our community health representatives, and more than 50 titles that are used for roles around the country that describe the work of community health workers. Next slide, please. Like all health or medical professionals, we want community health workers to build their capacity, their knowledge, and their readiness to understand COVID-19 and to be able to transmit accurate and factual information in their communities and through their services. We want community health workers to receive training by health personnel. We want community health workers to be authorized and recognized by their health teams to deliver medical information about COVID-19. We want community health workers to be prepared to inform, to guide and educate your peers to conduct appropriate health promotion and disease prevention. Next slide, please. So I'm giving here a snapshot of the roles of community health workers. Many of these descriptions may resonate with you in your work in community, in a health or social service system. Some of you may be promoting everyday preventive actions, increasing the ability of individuals to manage their chronic disease or promote healthy behaviors. Many of you are providing information right now to break down the myths and rumors that are present about COVID-19. Many of you are busy trying to identify populations who are most at risk. And earlier, Colleen presented that comprehensive list to you. And a number of you are right now actively referring clients to services beyond medical services or testing to help meet their psychosocial needs. Next slide, please. Community health workers can be an ear right now for so many millions of people whose lives have been disrupted by this pandemic. They may be experiencing a loneliness or a time of social estrangement. CHWs, many of you right now, are helping to organize food delivery, helping people to enroll in utility assistance. You're advocating with landlords to make sure that people are able to maintain their homes or negotiate their rents due to unemployment. A lot of you, I know, are busy explaining the changing rules and facilitating enrollment for social benefits and resources that are now available in your community and perhaps in your state. You're promoting preventive health behaviors to curb contagion, social distancing, appropriate hand washing, the appropriate way to wear a cloth mask. All of these are ways that you can promote to prevent the contagion. And many of you are busy reinforcing public health messages about COVID-19. We want to thank you for the critical role that you are playing and all of the ways that you're stepping up in this time. Next slide, please. Community health workers as experts during this COVID-19 emergency response time. Next slide. I want to say and lift up this important and critical workforce. Each of you who are on the call and you are a community health worker, you are a frontline public health workforce that is critical for localities and states to provide immediate response to the COVID-19 pandemic. Next slide, please. Some of the factors that are going to promote your effectiveness in service delivery in your community. Community health workers are someone who comes from within the community, someone who shares the experience, the language, perhaps the same chronic disease state. You speak the language and you share the experiences of that community where you're providing services. You know the customs and the issues that your communities face, those barriers and how to overcome them. You share the same social or cultural background of the community, and that can include the same local language, the same dress, the same faith. You also understand the myths and beliefs that are moving through community and how best to communicate actual and factual information to dispel those myths. Next slide, please. I'd like to shift gears now and speak to the important role that a number of community health workers may be serving in, and that is in going into the community and conducting home visits or providing community services at a shelter, at a food pantry. You may be shopping and delivering food to a person's home. This provides greater opportunity and a greater need for you to have the right information and the accurate kind of protocols and methods to protect yourself when you're conducting a home visit. So let's talk about what a home visit is and the ways that you can prepare yourself with your employer. A home visit is a set of social and health activities that are provided at a person's home or in their apartment. This is care that allows the CHW to detect, to support and control health problems that the individual may face, and also to help them move toward their health goals. It can enhance the autonomy of the individual that you're serving. And the overall goal is to improve the quality of that person or that family's life. Home visiting can be a set of specific tasks, making it a means of your liaisoning between the family and the health system and the services that people are providing. Next slide, please. During the COVID-19 pandemic, CHWs must establish priority criteria for making home visits. We know that social distancing is a critical way to reduce the spread of COVID-19, and so making a decision to conduct home visits is an important decision that should be prioritized. We're looking at families who have adults living in their home who are over 60 years or over, people who live alone or who are without family networks and support, people who are unable to travel easily to their health center or clinic or medical provider, families with ill or handicapped family members or patients, people who've been recently discharged from the hospital that you're conducting follow-up services for, and people taking vital medications. These may all be reasons, different categories of community members that you might prioritize in conducting your home visits. Next slide, please. Set goals for your home visiting services. Are you going to coordinate care for people who cannot leave their home and access services at a health center or clinic? How much information, education, or support are you going to provide to the patient, individual, or to the family? Will you facilitate primary, secondary, or tertiary prevention services? Will you suggest, and do you have the protocols to suggest when to go to an emergency room? Is this home visit necessary, or can this safely and effectively be provided through other means? Will you help the continuation and coordination of these services between the provision of health and social service systems? Next slide, please. There are a number of safety practices that we'll lift up now for the community health worker workforce when conducting a home visit and providing community services. We want to develop and sustain a culture of safety, even during these times when we know that there are many needs at the individual or community level. If you're conducting a home visit or providing community services, ask if the individual or family members have experienced coughing, fever, or shortness of breath. Ask if the family members have traveled recently to certain international destinations or those geographies in the U.S. that are known hotspots like California, New York, Louisiana, Washington State, or other states that currently have high numbers of people with COVID-19. Always follow universal precautions. Seek training if you do not have training on universal precautions. Those, of course, include hand washing before and after your visit, or if you're unable to carry and use hand sanitizer with you, that hand sanitizer should have 60% or more alcohol content. Do not eat or drink during the visit. Avoid touching surfaces or carry with you disposable tissue. Wear your gloves and your cloth face covering as instructed. Keep your distance from others, although that may be new for you, about 6 feet or 2 meters when you're conducting home visits or your community services. And don't take unnecessary risks. Go back to your priorities and seek guidance before you conduct that home visit. Next slide, please. There are myths and legends about the novel coronavirus or COVID-19. We're going to lift up just a few here. Rinsing your nose prevents contagion. This is not true. The virus is spread, as Colleen talked about, in a number of different ways, and we want to promote and practice a reduction of that infection and spread by washing our hands or using hand sanitizer, covering our mouth and nose with a face cloth, and applying our universal precautions. But rinsing your nose will not prevent the contagion, nor will eating garlic. While that may be a cultural norm and it may have positive benefits that you and your doctor have discussed, eating garlic is not going to protect you against COVID-19 or the novel coronavirus. Nor will sesame oil kill COVID-19. Spraying your body with alcohol or chlorine is not effective, and it is not recommended for you to address the COVID-19 novel coronavirus. These are myths and legends, and if you hear them in community or among your peers, refer back to these slides and back to the factual information that was provided earlier, so that people know how to effectively protect themselves. Next slide, please. Now I would like to turn the presentation back over to Colleen. She's going to explore some of the bilingual resources that are available through the CDC.
Great. Next slide. So CDC offers a variety of graphics that you can use to educate others about COVID-19 and the precautions that need to be taken to stop the spread of it. There are graphics that you can use on social media shown on this slide. Next slide. And some more graphics here and showcasing that we have bilingual resources and go on the website to see the variety of languages covered. Next slide. There are tip sheets as well that can be helpful in communicating with your clients and with those in the community. This slide shows the symptoms of coronavirus disease. There's a tip sheet there, and then also how to stop when you're feeling sick and identify potential symptoms. Next slide. So more tip sheets here, just a lot that you can look through and decide what's helpful for you. Next slide. A few other examples here as well, showing our bilingual resources. Next slide. We have infographics as well, similar to the graphics. These are helpful in getting across a good amount of information, really focusing on this factual information and messaging that's so important for you to disseminate in your communities and educate others. So these are useful as well. Next slide. And there are posters as well if you want to put these up in your community or in places where you can help spread awareness. These are helpful resources as well. Next slide. And lastly, there are videos, and those are in English as well as Spanish, and hand washing. I explained some of the steps of hand washing, but there are these videos that provide the visual and show you kind of the amount of time and could be very helpful for you in helping to spread awareness about one of the most essential practices of proper hand washing. Next slide. Right, so this is the end of our presentation today, and we hope that it was helpful for you. Denise and my contact information is on this slide, and so you can feel free to follow up with any additional questions. As we mentioned at the beginning of the presentation, the slides and a recording of this webinar will be posted on the CDC website, so you'll be able to access it. We'll now move on to the Q&A section, and we've seen that you've been entering questions and using the question and answer button during the presentation. You can type any more questions you have now into the chat box or the question and answer box, and know that we're documenting all of these questions and concerns, and we'll be using them to inform future efforts. And we'll move now to trying to answer some of the questions that we can today.
We have a few questions. One of them is, can this still be transmitted through kissing or community smoking?
So that is a good question. I think that there was a slide on this. Yes, it can be transmitted through kissing, and there is probably the potential for anything that your mouth touches to spread those respiratory droplets. Just following the best precautions you can about social distancing is really important, and hygiene, and not spreading respiratory droplets is important.
There is a question for, I think that this one is for Denise. Denise, they're asking do you see a role for community health workers in any state driving contact tracing efforts? And what are the roles could that be?
Sure, that's a great question. We have heard a lot, I'm sure, in the media and on the news in your state and around the country about the need to continue to scale up testing and contact tracing so that we can really understand the infection rates across the country and so that we can continue to protect our citizens. Community health workers historically have had specific roles in contact tracing. For community health workers working with STDs, they would have received this type of training, and many CHWs have done this work over many decades. Right now, there are states or cities in specific parts of our nation who are exploring and developing initiatives to stand up contact tracing, and often they are centering and prioritizing the community health worker workforce, not only to perform the specific act of contact tracing, but when they are engaging individuals and community members, to link them to care coordination and navigation of services and other supportive systems, which are the role and where the skill and competencies of community health workers really shine. If you are interested in contact tracing within your state, I would look to your Department of Public Health. I would carefully track the activity and those initiatives, as they will usually be presented by your governor, your state health department, or other source for you to get more information about those opportunities.
I have a question. It's a general question that I have here, but it's on 3 levels. One person is asking if soap and water is sufficient for disinfecting, while another person is commenting on whether the masks are sufficient, the fabric masks are sufficient for avoiding the virus to come through. And if that is, and if the answer is no, would that be in the best interest of the patients when we're visiting?
So those are both 2 great questions. Regarding disinfecting your hands, hand washing with soap and water for the recommended 20 seconds is what is being recommended. And so that's really important for your hands, or you use the alcohol-based hand sanitizer with 60% alcohol. As far as disinfecting surfaces, that's where the recommendations to dilute some solution of bleach are recommended, and so that is how you clean the surfaces. But I advise you to go to the CDC COVID web pages to look at more on disinfection, hand hygiene. There's a lot of good information there, and so whatever your specific purpose, there's just a lot there that you can look up and make sure you're doing the practice that is recommended for what you're doing. And I'm sorry, the second part of the question was about cloth face coverings. So we don't know everything yet about how things are spreading. The CDC recommendation right now is wearing cloth face coverings in public. And I advise you to go to the website and look at that as well. And really, there's a lot of guidance on the web pages. There's a FAQ section, and you might find some references to pages there about preventing infection and protecting both yourself as a health professional, and also working in communities and working with households. So I would look at those and make some decisions, based on that information, and continue to look at it as we're updating it with new guidance and information. We don't know everything yet, and so webinars like today are really important for us to take your questions and take that back and continue to develop that information to help you.
There are conditions such as HIV, and many people on the chat box were discussing other conditions that are that do affect the body greatly. But in the case of HIV, once it's treated and controlled, are these immune compromising diseases at risk of infection or complication, at any higher risk of infection or complication of COVID?
Can you repeat the question?
Yes, specifically in the case of HIV, that it's an immunocompromising disease, but it can be treated and controlled. Once treated and controlled, am I still at a high risk of contracting the virus or developing complications?
I don't think we
Well,
can.
just briefly, I'll refer to the earlier slides that Colleen presented. There are many different categories that can put someone at increased risk. So if the person is asking if that person is able to manage their HIV, if they're taking their medications, or if that is not an issue, there may still be other issues that make that person at greater risk. And so maybe we'll have Colleen just go over those increased risk factors and those categories again for people to understand that there can be intersection. There can be many factors that can increase your risk for infection.
That's right, Denise. And it's important to remember that we can't speak to your risk as an individual, but we have these categories of individuals where we know that the risk is higher. And the notes that we have are that there's not all the information we want right now about the risk of COVID-19 in people with HIV. We know that those that don't have it control are probably more at risk, but we can't say that those with control, are not going to be at risk. So I think it's safe to really look at these categories and take the precautions needed if those risk factors are there. And in your patients and yourself, it's just very important to protect these populations. So I'm referring now to slide 23 with those who are immunocompromised. I'm just going to read the list one more time. This includes those undergoing cancer treatment, smoking, bone marrow or organ transplantation, immune deficiencies, and poorly controlled HIV and AIDS. And then the use of any immune weakening medications. So it's a really, could be a lot of individuals. So it's just really important to focus on those people and not underestimate your risk.
There is a question here that it's making reference if we have other languages available for resources besides Spanish.
Yes, and I'm not sure the exact number of languages represented on our website, but we have a number of different resources. So please visit our communications and those resources and see if you can find what you need. And if you can't, please contact us and let us know what you need, and we'll communicate that.
Another question I have has to do with community health workers. Are they factored in the workforce development planning for coronavirus contact tracing teams?
Sure. So as mentioned before, there are a number of national initiatives as well as initiatives happening at the state or city level that are all considering the critical role that community health workers can play right now to enhance public health capacity specific to contact tracing. Contact tracing is an important aspect of the role of community health workers. One, because we have an ability to really build trust and to provide respectful services in a language and in a context that many communities that may be not difficult to reach, but may experience barriers to accessing the health system or information about infection, and CHWs are able to reach them. So yes, there are many initiatives that include a role for community health workers. The National Association of Community Health Workers, what we are doing is offering to people clarity on the role of community health workers, that we are effective to support contact tracing efforts, and that we are also effective to continue to provide all of the other services within our roles and our qualities and skills in this time of emergency response.
Thank you for that.
There is another question related, and this is, I guess, for you again, Denise. If you have any pearls of wisdom to share with them about how to best spread the preventive measures and messages in the Indian country, especially in rural areas.
Yeah, our rural communities have unique challenges. There are many community health workers who had their initial face-to-face or community-based services disrupted, and a lot of them transferred or transitioned those services to phone-based services, onto Zoom, onto different web platforms, or even telehealth. But for our rural communities, there are real barriers and there are real challenges for community health representatives or CHWs to connect with their communities. If you are still conducting home visits, one, I hope that you have support in your transportation. So if people are reimbursing you for the services that you're providing, I know many of you have to drive several miles to reach and connect with your clients. Please refer back to all of the safety precautions to conduct your home visits. Oftentimes, if people are coming into town or coming into to clinics to get tested, that may be an opportunity for you to share or distribute information so that you don't always have to travel to communities to conduct those home visits. This is really going to take a networking and a collaborative effort for all of us, but particularly for folks in rural communities. So for instance, if you are attempting to service elders and you know that perhaps there is a separate service, one that you do not provide, that brings food to the home, maybe you want to try and coordinate your education and your services with those services so that you're better able to get the services to the elders who need them, and folks don't have to make as many visits to the home, increasing the risk of infection for that vulnerable individual. At NACHW, we have representatives from the CHR community who we would love to make connections with you. They work across the country so that you can get specific answers on ways to innovate and coordinate services in your tribal nation.
Colleen, I believe that someone is asking regarding the probable cases. Can you expand on that a little bit more, specifically under the perspective of testing being available?
So the testing, probable cases, and kind of the suspected cases of COVID, and kind of erring on the side of caution when those are sick. That's kind of how we've been going about this, but testing is, picking up, and we will be able to confirm cases of COVID when testing is widely available in communities. But kind of in the meantime, as testing's been being stood up and tried to get it widely implemented in communities, we do need to take the necessary precautions around probable cases and around suspected cases. And really the guidance and the recommendations from CDC right now is erring on the side of caution with regard to symptoms and following these safety practices. And that's what you're seeing with our social distancing measures and all the messaging and recommendations right now.
Is it also a myth that people who suffer the flu are at high risk of testing false positive to the virus?
I have not heard that to be true, and I'll see if any others on the call have heard that. I don't think I've heard that. I would look on the website.
I haven't seen that in the Q&A on any place there.
No.
Thank you.
There is another question here for Denise, and that question is, are CHWs being given additional resources and training to learn how to conduct some visits through telehealth? This might help reach more clients in rural areas.
Yes, so I have certainly heard from community health workers and employers across the country that they are offering, for those who offer telehealth services and for those who can reach their clients that way, they are offering free trainings. There are also a number of different online platforms that are offering free software and free trainings as well. If you work with an employer, I'd reach out to that employer and see what is the approved platform for you to conduct telehealth services. But certainly there are a number, all of the kind of popular platforms, including the Google Hangout and Zoom, a number of them, Microsoft Teams, a number of them are offering free services and supports so that if you want to transition your telehealth services, you can better understand the benefits and kind of the functions of those tools.
On that very same thought, what are the thoughts about virtual home visits and maintaining patient privacy, patient-client privacy?
Yeah, well, if you've already been providing services to those clients, that individual or family member, hopefully you already have the appropriate waivers or approvals or signatures to provide service. So let's assume that that person has been working with that client before. There are some security issues with using telehealth. We know that I've even had one of my Zoom meetings to be hacked. I don't know what the official term is, but someone just kind of jumped onto the meeting, and fortunately we were not addressing a HIPAA protected or a confidential issue at the time. This is why you really want to understand the platform that you're using and why you want to receive proper training about that. You need to get the approval from the patient, from the individual or family, to be able to communicate with them in that way. I know when I was providing services for people living with HIV/AIDS, we needed to get that individual's consent before we could make a phone call, before you can leave a voicemail, before you can, leave a note or notice in the mailbox. So please consider all of those privacy and protection protocols before you are rushing to implement telehealth. Even in your desire to want to reach clients, we have to protect their privacy.
There is another question here for you, Denise. Should community health workers continue with routine home visitation activities, or should home visit only be reserved for those patients more at risk or with serious conditions or needs?
Yeah, so if you have an employer and your employer is recommending or asking you to continue to conduct home visits, I would hope and would advocate for that employer to provide you with the appropriate personal protective equipment, as well as some of the safety precautions and protocols that Colleen mentioned before. So if you don't have training in universal precautions, if you do not have access to gloves, hand sanitizer, and appropriate cloth mask, if you are not able to conduct that home visit and maintain a social distance of 6 feet or more while you're conducting that visit, and if this is not a priority visit, if there is a way to conduct the same service in a no-touch or a low-touch fashion, I am advocating for your safety and for the safety of your peers, your coworkers, your family members, that you do all that you can to protect yourself and your clients. So work with your employer. Make sure that you understand and that you receive training, as we mentioned earlier, from a medical professional, so that you really understand how this novel coronavirus is transmitted and how it can infect you. Understand the risks of the clients that you may be serving. And if they're at high risk, do what you can to reduce that risk by practicing and applying all of those safety precautions.
Well, we're reaching the time to almost conclude our webinar today, but I want to give you, Colleen, the last question. And this one is, why is an N95 not recommended to wear during a home visit?
So these masks are being reserved for healthcare professionals right now. And so I'm not sure that we've provided at CDC any recommendations for home visits yet. But that is the guidance we have right now, is the N95 masks are recommended for healthcare professionals, but I think it's important to talk to your employer, and I would advise you to go to the CDC website and look at those pages for healthcare professionals and what's being recommended to protect yourself and protect others, and be knowledgeable of that and talk with your employer.
So we have reached 5:01 p.m. We should be concluding the webinar. Ladies, please go ahead and conclude the webinar for today. Thank you very much for being with us. Please conclude the webinar.
Thank you. It's been great, and these questions have all been helpful discussion, and it's been great to hear Denise as well.
Thank you, everyone. Thank you, Betsy and Colleen and all the team at CDC. And for everyone on the call, my prayers are with you and your family and your community during this time.
Slides and webinar are going to be available pretty soon. Stay tuned. Some of the questions that have been raised will not be forgotten. So stay tuned. We're going to be coming back to you all. Thank you very much.
Thank you.